and being associated with people that we are, the county residents. We ask that you lead, guide, and direct us on each of our decisions today. Thank you for our known blessings, and we thank you for our unknown blessings. In Christ's name, amen.
Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Motion to approve this, got it? Yeah, go ahead.
Mr. Westbrook, we do have with us the folks from Waste Pro that I don't know if you want to add them at the end or let them go at the beginning.
No, we'll add them now and keep them in the spending eye. We're not gonna be here long anyway. I don't
That
think.
would be the only addition that I would
Okay, that'll be fine.
Is that relative to a specific issue or just a?
just
No, just
Update.
see if we wanna ask them questions.
updates, just right.
Board recognize anybody that wants to ask them anything?
Thank you very much. I'm Lloyd Childry with Waste Pro, and then we have,
Rebecca Dodson.
she's also with Waste Pro. She joined us at the beginning of the year as our division manager. So, she is in charge of not just the operations of our company here, but she's got a fiduciary responsibility to it as well. So she gets it from both sides. So,
Anybody
here
got a
to-
question on the board?
Yeah, I've got one question, and I think I know the answer, but I'd like to hear from you. I've had a lot of my constituents say that they thought the Waste Pro containers were smaller than the waste management containers. And I thought I remembered that question being asked during presentations. And as far as the volume of the containers, that the configuration may be a little different, but the carrying capacity or the volume that each of the containers contains, is it the same or?
The difference is the name on the side of it.
Yeah.
And I'm not saying Waste Pro or Waste Management. We use a toter cart. It's manufactured by a company called Toter. Waste Management's carts, they hold probably not the exact same volume. People will say that ours holds 1 gallon more, but the configuration of the cart is different. So when you look at it with the naked eye, it may appear that ours is smaller because it sits just a little bit lower, but it has more capacity and width.
Has the transition in changing out waste management containers to Waste Pro containers, has that been going fairly smoothly as far as you know?
It depends on who you ask.
Sure.
In our world, in the garbage world, it has gone smoothly. I know in y'all's world where your phone rings, it's probably not gone as smooth as you would have liked to have seen it. And there's several reasons for that. I won't get into the details, but I'll tell you that we ordered 11,232 carts. There's about 83 to 8,400 homes out there. We've delivered dang near every one of those carts. And what we've done is the data that WM gave us, and I say us, both of us used a company called Trios. It's a third-party company that we both have experience with. And the ideal way for this to happen is for the data that WM has, they give it to that contractor. They go out and they pick up carts and then they drop ours off. That was the way we wanted to have it done. And for the most part, that's how it happened. It didn't happen exactly that way in some parts of the world because the carts weren't out or I don't want to say the data was bad, but in some instances, there were waste management carts out there, residents that were not on these data sheets. So if they weren't on the data sheets, we tried not to, but then we started finding that there was more out there than we had originally thought. So we did start just taking those cans and putting ours in that place. And then we're going to fight that battle later. If they're not customers, we'll figure that out sooner or later. When the bill comes in and they don't pay it, then we'll know that they're not the customer and we'll go out and we'll retrieve those carts. To my understanding, and if I'm wrong at any point, because you're in the field, please jump in and correct me. there are still a lot of waste management carts out there. I don't know that the third party company is still actively employed or working with waste management to retrieve those. If that's the case, we can't touch those carts. They belong to waste management. If waste management chooses not to get them and just call it a lost leader, the commission, we would ask the commission to either claim that those things are in the right of way and hire a vendor to go out there and go pick them up. And whoever that vendor is can place them in a common area where they can be retrieved. But we can't touch them unless we're either that vendor or Waste Management gives us permission to go get those. And to this point, that's not happened.
And what is the reason for not being able to touch? Is there some kind of law or something
It's their property.
with that?
It would be like if I went into your yard and took your truck.
Please don't, I don't know.
But at the end of the day, we have several carts out there that are on residential properties that probably do not have service that we'll have to get back. There are going to be situations out there where they have two carts, ours and Waste Management, and they are filling both cans up right now. For the first 2 weeks of the contract, we picked both of them up, as we said we would. We're now in the third week and we're talking about not picking those up anymore because that's just extra volume that we have to pay for at the landfill. If it becomes an issue where the county is getting more calls or it becomes an issue for the county, please let me know and I'll sit down with our folks and make sure that either A, we express our feelings to Waste Management again, or we'll go pick them up and then we'll have another discussion after that.
Jim, can we get out a public service announcement, basically summarizing the situation and letting those residents know that if they still are in, if they still have both cans for both Waste Pro and Waste Management, that at some point in the near future, that they don't need to continue to place garbage in the Waste Management can because it won't be picked up. And that, if we can head some of that off, it certainly would be beneficial.
Yes, we can do that, and probably also reach out to Waste Management and ask them to pick up the cans that are alongside the road.
How long before you, once somebody becomes in arrears with their payment for their garbage, how long before you add charges to that?
So the way it works out is we're billing quarterly. So they'll get 3 months of service. And then 2 weeks after that, they'll get a notice that they haven't paid. And then they'll get a phone call. And then 30 days will go by. So they're going to continue to get service because there are times where people just, they got lost in the mail. So we're not going to just go out there and stop service. It'll be 30+ days before we do that. And that would be after the quarter.
That's generous enough.
Yes, sir. One of the other things we did do, and trying to maintain a relationship, not with just Waste Management, but with the county, is we extended our properties that we purchased, the bus barn, and we brought all of Waste Management's front load cans in there. Not only did we allow that storage area at no charge, we dumped those cans and brought them in and placed them in there. So at every point of this transition, we felt like we were working as best we could with Waste Management. So we're hoping that at some point, we'll be able to move forward with them, and those carts that are out on the streets will be picked up. And any discrepancies in the way things were done can be corrected.
Dr. Spires, are you with us?
Yes, sir, I am.
You have any questions, sir?
No, I think the ones that I had have been asked and answered.
Okay, that's fine. Anybody else? Go ahead.
I would like to say I've not received but 3 phone calls.
Yes, sir.
And Ms. Dobson's handled all 3 of them, and as far as I know, everything's settled. So
That's good to know. It's good to know that when you make those calls, that it lands with someone that's gonna take care of it.
I assumed that it'd be a lot more problem than it was.
And if I could, Ms. Dodson has done a good job at, we have sent her names and, sent her problems, and she's been able to work through them, so.
That's wonderful.
Rebecca, can I have your number?
Yeah,
Seriously.
850.
Yep.
573-2629.
Thank you.
Mr. Crutchfield.
It seems to be working pretty smooth for me. I've had some calls and all, and, I know personally myself that y'all did exactly what you said you'd do. And they did come get my can, but I do know there's some cans out that I see traveling, around myself in the area, and they still some there. Whether they pick them up or not, I don't know. But I've been telling people that called me, and I don't hear anything back from them. If don't put it in the waste management can, put it in yours can, because you won't pick it up.
Right.
So I hadn't had any feedback on that since that time, and I know Miss Rebecca, before she made the transaction, y'all, and I know she'll do a good job for you.
Thank
Well, we know she will too. That's why she's with us.
Yes, yeah. She know how to handle it. And one thing about, problems, you make a transition like that, they gonna be problems. As long as you work it out, that's what counts.
Well, and when we hope that we have kept the lines of communication open, not just to myself, but to
Yeah.
Ms. Rebecca. And that will always be the case. She being the division manager will always be the front line for anything that needs to happen. I don't want to say I'm the secondary, but at the end of the day, if something needs to happen, quicker,
Yeah.
please don't hesitate to call me and we'll make sure that it happens.
Just so long you got a phone, somebody else, I'll be happy.
Yeah.
Well, I know all y'all have my phone and you're not afraid to use it.
Yes, ma'am.
Thank you.
Yes, sir.
And I thank y'all for trusting us
Yes,
to
ma'am.
provide the service that we're doing. And
Yes,
any
ma'am.
issues I do want to resolve immediately. So don't hesitate to call me or have a customer call me if need be.
We appreciate y'all very much. Anybody got anything else? Mr. Crutchfield? Dr. Spires, you still okay?
I'm okay, sir. Thank you.
Okay.
Thank y'all for your time.
Yes, sir. We thank y'all for coming.
Yes, sir.
Ready for the public hearing, Ms. Westbrook?
Yes, sir. I am.
Okay.
We, you read it. That'd be fine.
Well, yeah. At this point, I guess we'll go into that public hearing regarding, the CDBG Community Development Block Grant, and any comments from the public as it relates to economic development, community development, or community impact and environmental impact associated with potential projects that might be considered for Community Development Block Grant Program. There is one potential project that the county is considering, and that is the development of a new well site, or not a new well site, but a new well and a elevated water storage tank to improve the capacity and the volume out at Interstate 10 and Highway 71, as well as the surrounding area that is served by the county water system. As the commission knows, there's a large amount of development out there at I-10 and 71, and there's a desperate need to improve our water system out there as it relates to capacity and volume. And so that is one of the potential projects that we would solicit comment from the public on. And at this time, I guess, not speaking for the chairman, but are there any comments?
And the tank will be offset from the well,
Yes.
is the way we have that planned at this time.
Yes.
Right? Okay. When I mean offset, gentlemen, I mean a long way, not over in the bushes.
I guess since we're not hearing anybody, wishing to speak either in the audience or online, is it appropriate to ask questions now?
Yes, yes, sir.
It is the, development of the, well and the elevated storage tank, is that what we'll use the 1,500,000, the economic development grant for? Or so are we looking at using dollars from both for that?
The potential funding source for 100% of the project would be a community development block grant. And the estimated cost, depending on which aspect you're looking at, would be the 1.5 million, but combined, it's estimated to be 3.2 to 3.5 million dollars. But again, all of it would be potentially funded with a CDBG.
Okay, so even though the estimated cost is 3.1 to 3.2 million dollars, we anticipate being able to get CDBG grant funds to cover the entire cost.
Yes, sir. That's the goal.
That's good.
Yes, sir.
It's something that needs to happen.
Yeah. Anybody with any questions? Well. we
Mr.
about
Chairman.
Find it up then. Go
Mr.
right
Chairman.
ahead, Dr. Spire. Go ahead. You
Okay.
got time.
Okay, geographically, where would this tank be placed?
Mr. Spires, it's anticipated that the elevated storage tank would be located over near the Camp Real Life, Camp Anderson. If you recall, the county had negotiated with Camp Real Life to exchange a piece of property for that elevated storage tank in conjunction with their utility services. So the tank would be located in that area.
Okay, I'm sorry, Mr. Dean. Camp Real Life, I'm not familiar exactly where that is.
Yeah. Mr. Spires, remember the Baptist College Convention Center over near the Mill Pond?
Yes. Mhm.
It's adjacent to
Okay.
that, over there where the long-term care convalescent center is located. It's in that area.
Okay, all right.
Courtyard.
Thank you.
Dr.
Okay, thank you.
I fixed all that stuff for him about 10 years ago, 15, 12, whatever. That on the same road that goes to the convalescent center there, it's down there, about 3/4 of the way or a little further. And it's directly behind the Camellia Acres subdivision as well. There's
Okay.
already a 10,000 gallon tank there and two wells, a well and a backup that we put there at about
Okay.
about 2010, 12, somewhere right along in there. It was a long project.
Okay, okay, all right. I have an idea now where it is. Thank you.
Yes. Anybody else? All right, that winds it up.
Next item, Mr. Westbrook.
Yes, sir, go right ahead.
Okay. The next item that we have is, if the commission remembers, each commissioner has met with Mr. Tim Hummel. He is here representing a healthcare program that is provided by a company called Revive. This is a healthcare program that is 100% voluntary. No employee is required to participate, and it's provided at no cost to the Board of County Commissioners. And again, each commissioner has met with Mr. Hummel one-on-one. It's a healthcare program that is pre-taxed, and therefore it reduces the amount of federal taxes, FICA taxes that have to be paid. And the result of that is that it increases the net pay of an employee that participates in the program. Mr. Hummel is the one that would be administering or educating our staff should they decide to participate. And he's here tonight to answer questions or, provide information. But we're hoping that the commission would make a decision on whether we should allow our employees to participate in that program tonight. The Jackson County Jackson County School Board has already signed up and it's signing up. There's some of the employees that desire to participate, and there's also a private company here in town that's participating as well. Mr. Hummel, I'll be quiet now.
Any questions?
You go right ahead, or what's the pleasure of the board? Want to ask questions?
Well, I'll make a statement. I've been back and forth on this issue. I guess we've heard from Tim, and we've heard from some other insurance consultants, I guess you could say. I guess the main concern is that this has never been I won't say fully vetted it, but I don't know that we've heard from a tax certified attorney that has come out and said that this is totally legal. Is that, and I know that when we had our meeting, we had several people there, and I think the answer to that is that you probably would not get a tax attorney to say that.
I have a tax attorney on with us right now. And I also have Mr. Slava, who is the CEO of VHP, who would be administering this plan. So I couldn't get him to patch into the system here, but they are both here. I have Skip Coomer, who is a tax attorney out of California. All I could do is turn the bike around and have you guys ask him some questions.
He was present at our meeting that we had
100%,
in
yeah.
Mr. Dean's office.
He was. So if there are any direct or specific questions that you guys have for either Slava or Skip regarding the program, the tax implications of the program or anything like that. Can you guys hear Slava, Skip?
Yes, we can hear. Yes, perfectly fine.
You guys hear?
I recognize the clerk.
Yes, sir.
The only question I have, and this is from a very selfish standpoint, what are the reporting requirements of this program, and who would be responsible for doing that?
Slava, did you hear that? The reporting requirements and who would be responsible?
Yeah, reporting requirements are all on us. So there's a number of reporting. Obviously, the 5,500 forms, they are filed by our TPA, but also the reporting to the board to show usage. So we strip out all personal identifiable data, of course, for HIPAA, but we report live on a dashboard the usage of the program, so you can see how many people are calling in for what CPT codes are being submitted. We just don't show who's doing it. So you'll be able to see how much you're saving in redirection for the healthcare, what percentage, like maybe, 10% are doing it for sinus, 5% for UTIs, whatever it is that people are calling in for. You'll be able to see all the reporting, and that's done by our company. We collect all the data, we house all the data, we just report to you, and the proper, like the 5,500 forms have to be filed with the IRS, for example.
Speak to the payroll side of it, Slava, if you would, for a second.
Sure. So because it's a pre-tax deduction, it allows the employees to save money. Now, the goal of this program is not to save money. Maybe the employees will have their paycheck increased by, $40, $50 per pay period. It's not much. At the end of the year, it does come out to a little over $1,000. So it is something, but really it's going to increase their pay by 1%, 2% at most for low paid individual. The goal here is to offer these programs to get people healthier. There is so much going on in the healthcare system, so much that we can do better. So for example, there are people who need access to mental health, but they're not getting it because it's expensive. It has copays. You have to travel somewhere to see a psychiatrist. We offer something from the comfort of your own home. The ability to talk to a nutritionist. These are real doctors. They work for us. The ability to talk to doctors. If you want prescriptions, we own the compound pharmacies. If you walk into Walgreens, CVS, Walmart, whichever pharmacy, show them our card.
There's no addition.
Hold on 1 second, Slava.
On the prescribed medications is now going to be zero.
Slava,
So
is
goal, as is being requested, I'm sure you see it on the news all the time. We need to do better. When serving our communities, we need to give them better options. We need to give them easier options.
hey, Slava, 1 second.
It is done.
More on the like the end of the year reporting, the stuff that they would have to do on the accounting side. Is that what you're asking, Clay?
Yes.
Boxes of the W-2 and things like that. That is something that I have worked with my clients and the EHP staff to make sure before this goes live, we will sit with whoever's processing the payroll to make sure that the codes are implemented the correct way. And then that will all flow through to the correct spot on the W-2.
If somebody there can answer what payroll service you use, or do you use something internal?
It's internal.
Internal.
Internal, okay. So it would probably take us an extra month and a half to implement, but we can implement through APIs to report directly so that as you have new employees or employees are terminated, We will just add the code automated if you'd like to do it manually. It's fairly simple. When you have new employees, there's a small form you fill out sent to us, but it's reported on your W-2 just like your health insurance is. So as far as reporting, it's already in there. There is no extra work that you have to put in except the initial setup.
It took me about 10 minutes to do with the school bill. As far as,
All the employees?
no, theirs was a little bit more difficult because they had to go in each employee. So depending on the payroll system, like when I've used ADP and Paychecks, you create the payroll code and then you go click each employee that you want to implement those codes for.
I think that's gonna be similar to what we do. We'd have to set up a code. And then they'd have to go into each payroll file. Yeah.
Right, and it takes, the initial will take some time, I mean, but you've got to, once they're on, and it just kind of runs that way.
It's identical to your healthcare. When your employees buy dental, for example, you have to put in a code for the deduction. Same exact thing, takes the exact same amount of time.
You satisfied with that, Mr. Kirk?
Well, not really, but yeah.
So, I mean,
Well,
It's another hoop.
you've got a little more experience in that than most of us.
I'll have to set that up.
That's why I said it's not, if it's a automated company like a Paychex where you can kind of do that, it's a lot easier, but I sat with Jessica over at the school board and we kind of worked through kind of where to go, made sure it was right. We ran several payroll iterations to make sure that as we processed payroll, the numbers were looking right based on what we estimated and told the employees that they were going to look like. So,
Mr. Crutchfield, you recognize?
Yeah.
Mr.
I'm for one, that if anything we can do for the employees, I'm all for it. But they not, we got an attorney there, there's no loophole that could come down the road to make them how to pay that back, are they?
yep.
Well,
It's 100% safe.
I don't believe that there would be any clawback in a situation where Congress decided they didn't want to allow this any further. Congress knows of it. They've had opportunities to change 105B and they haven't done it. And so there would be no, I could see no logic for any form of a clawback.
And if I may be allowed to just add to that, even though, and Skip is one of our attorneys, probably the best one, we have more attorneys than we have CPAs. However, even though we understand that due to, and Skip was the one that gave me all the precedent by the Supreme Court that the IRS isn't allowed to claw back. That's great, but peace of mind is important. We have a policy. It is for $20 million. If we need it, we're going to increase it to $50 million later this year. It'll be part of the documents when you sign up. It will show that if the IRS ever does a clawback, which we don't think they ever can, but if it is, the top company on there, it's a layered policy by 4 insurance carriers. So we have backup upon backup. The top company is Tokyo Marine, one of the largest insurance reinsurers in America. Actually, they're out of Tokyo, but they're an American reinsurer. It will pay for any clawback. So we want to make sure that this is 100% risk-free, which we're pretty sure it is. But now it's also peace of mind. Yeah, we're going to make sure everybody's protected.
Does that make sense?
Mr. Chairman,
Go ahead, Dr. Fire.
okay, I wanted to ask, would payroll deposit be a requirement?
I think I heard something about payroll deposit.
Yeah.
The way the codes are put in, there's 2 codes. One is a pre-tax deduction. One is a post-tax reimbursement. We're going to educate the employees on a webinar exactly what it's going to look like, what the accounting principles are. But we'll also tell them that, look, this is going to take 90 seconds for us to explain. If you fall asleep, all you need to do is look at your paycheck and look at that net pay. It's gone up by 40, 50 bucks. Well, that probably means we kept our promise. There's not going to be anything other than 2 codes that they'll see. And then that third number, the most important one, the net pay, it's gone up by a little bit.
Is that what you
I'm not so sure. Now I'm asking, would payroll deposit be required for each employee who participates?
You mean direct deposit?
Direct deposit, yes.
No, their check is going to be changed either way. It's whether they get a paper check or a direct deposit. Is that,
So there's no requirement for direct deposit.
no, sir.
Yeah, so right now, if the employee, for example, has dental, through the city, their check will have $40 less because they have a deduction. If they implement and use this and they agree to participate in the wellness program, their check will just be $40. It's not a separate check. It's part of their current check.
They're not gonna get an additional check. It's just kind of increasing the net take home
Say
pay.
that again. Say what you said.
They're not going to receive an additional paycheck. It is just gonna increase the net take home of their current check. So whether they receive a paper check or direct deposit,
It's gonna go up one way or
same,
the
same,
other.
yeah.
And as I understand it, and you correct me if I'm wrong, Tim, but when you meet with, one of our employees, you'll walk through that scenario. And if there is the potential there would be no change, then they may not want to participate and don't have to participate.
Correct. We've, go ahead. I'm sorry, Slava, you can talk.
So that's correct. It's 100% a voluntary model. We have to abide by all ACA regulations, and ACA regulations state that for these models, they must be voluntary. We're also, before anything is implemented, we're going to run a mock payroll just to verify that all the numbers that we are pretty sure and we're almost always correct, but almost always doesn't meet we have to be accurate requirements. So we're going to run a mock payroll. We're just going to verify that, yes, the numbers that we estimated would increase the employee's paycheck, that those are accurate.
And we did that with the school board as well, where we run mock payrolls a couple times just to make sure that they change, that they change what they change and so forth.
They change for the positive.
For a moment of pause, I recognize Mr. Cephas Granberry from the Jackson County School Board, and Mr. Michael Jackson from the school board in our midst. We welcome you and we're glad you come. Thank you. And if y'all would need to come to the board, we'll be finished with this here shortly and we would allow you to come forward. Any other questions? Dr. Spires, you still okay?
I'm okay, Mr. Chairman.
Okay.
Let me, again, try to get my arms around all this. I guess as a result of my meeting, and the explanation that we've heard tonight, to me, the negative associated with this would be the initial extra work that would be placed on the clerk's office associated with the transition, and then a small chance, and I'm going to call it a small chance, a very small chance, potentially, that the IRS could change regulations as it relates to this, and that our employees at some point in the future could be asked to pay those dollars back. Even though I've heard a number of times that the chance of that happening would be very, very small, very unlikely. I guess it's still out there. On the positive side, it's a voluntary program only. I think all of the employees will be made aware of that it's entirely voluntary. All of the employees will have somewhat of an idea of what impact, if they join up, this will have on their paycheck. And it would potentially mean for a number of our employees that they would increase the amount of pay that they're taking home every week. And for those lower wage earners, I mean, that could be a big impact.
Yeah. And if I may, with the downside for the IRS, that's what that policy is for. So that $20 million insurance policy is to cover if that were to happen.
And to reiterate, it would need to be Congress that changed those statutes because of the lawsuit, the big case last year. The IRS no longer has the ability to interpret Congress's laws.
Say that again.
So they can't go.
He's referring to a tax court case, a local Bright
The
case.
Supreme Court.
Supreme Court case.
Yeah.
Last year, local
Yeah.
Bright, where
Yep, Loper Bright,
Congress
Enterprises.
can no longer interpret the
IRS.
law. The IRS
Yeah,
can no longer interpret.
administrative agencies in general are no
Is that
longer
the
allowed
Chevron
to.
doctrine?
Framers of our Constitution, if I
This
may.
is local Bright.
Yeah,
Chevron was
local
prior
Bright.
to that, correct?
that was,
Program's been around for 13 years. We're just looking at adjacent cases because we like to
mhm.
keep abreast of what's going on. So it wasn't about this program, it was something just totally different, but we're just keeping an eye on it, what's going on. Every administration except for the last one seems to have tried to take credit for this program. I don't know why they keep doing it because it's been around for 13 years. The goal here is to just reduce healthcare spend. So I know that, yes, there's a financial component. It's a benefit to the city. It's a benefit to the employees, which is great. I think the bigger win is the additional benefits. The ability for an employee to wake up in the morning and talk to a doctor that has access to their records, not just a nurse practitioner, but an actual doctor. The ability for, if somebody wants to lose weight, to have a nutritionist assigned to them. And this is now theirs. It's not a Jenny Craig salesperson. There's so many benefits here that the employees can take advantage of, and it's always free for the employee, their spouse, and up to 6 dependents.
Mr. Donovan.
Go ahead.
The only problem I have there is making sure that each one of them is told that they could be a slim change, probably not likely, but explain everything to them, just like you explaining to us.
When we did it with the school board, we did. We were out in every school from November until they left for winter break, meeting with the employees and walking through the same documents that you guys have in front of you, walking through a sample paycheck, letting them know what their check would be. And we also spoke about the impact that it would have on their Social Security. And so I'm a financial planner by trade. This is kind of right up my alley. It gets people to start thinking about their finances a little bit, and it puts the money back in their pocket to do so. And that's what drew me to this a little over a year ago, especially for this area.
And basically what he's saying too, he just wants to be assured of it. Our employees mean a lot to us. We all live in the same place, really and truly, in this county. So that's a very valid point he's making, in my opinion. Go ahead.
If it's not 100% saying, there's a chance, little chance, but they need to know that little chance. It could be, cause I know myself, some people are a little more gamblers than others. And, I definitely wouldn't want to have to be paying back something that I got, and I sure wouldn't want them to have to either. And I want them to know if they go into that, what the chances might be, ahead of time, cause first thing they're gonna hear is more money.
Right.
And they may not really listen to the rest of it, that's the only problem I have,
Yeah, I agree.
We realize the program's only been around for 13 years. Maybe 20 years from now, people will stop worrying about it. But for now, we do realize that we have to reveal everything about it. But that's why we have that indemnity policy, that just in case they're covered, it's up to $20 million, which is more than enough for this case. And
Mr. Branch, you recognize?
we're going to show them everything.
As long as everybody's gonna be met with, everybody's gonna be told the pros and the cons. It's voluntary, it's up to them, it's not up to us, so.
Yeah, typically we get 80 to 90% participation in the first year. Second year, when they see what their employees have and they don't, we typically get close to 100%.
Is it an open enrollment situation? Right.
Yeah, so
Insurances.
so it is an open enrollment. We would set an open enrollment date. I would not correspond it with your major medical because people will get confused between the two. They want to have the major medical. This is not something that needs to be replacing that. So we would kind of stagger that. That's something they have to have major medical for this in order to do it. So
We'll make our motion.
Really, I know that the workforce for the county is certainly different demographically than the workforce for the school district, but you've gone through that entire process with the school board. what's the percentage of participation there approximately?
Um,
I'm sorry.
we're at about a 60%
60%
of those that have met with us.
of those.
And,
that you
and
met
yeah,
with.
and that's the hard part. I mean, it's hard to go into a school and have the teachers take their planning period to come sit with you. And so, we're about a 60%,
Numbers wise, what would you say?
right around 160. And, we still got about 400 that we are having a second enrollment for them starting here in the next couple of weeks. And part of it is because now there's people at the school board that have had it, that have given us some feedback, they've used it. And we're getting calls from people, hey, can I enroll in this now? That I didn't even know you guys were here, but we didn't chase them down around the halls. It was more of just, we sat in the planning room and answered questions.
Mr. Crutchfield, you recognize?
Yes, sir.
If some of them enrolls in it and later down the road they want to get out, can they do that?
This is section 125. So being pre-taxed like that, you are enrolling for the year unless there's a qualifying event that happens. So that is, you can't get out of it for the 12-month period that you enroll unless you have a
But you
qualifying.
can't get out of it.
Yeah,
Later-
the next
later.
enrollment, you can't. Just like, I'm assuming most people who are doing the benefits here, if they're pre-taxed, they have to stay in for that fee.
That needs to be explained to them too.
Oh, it is. It's,
Yeah.
The chair will entertain a motion.
Yeah, and I think it goes back to it's entirely voluntary and, I'm a proponent of it. I'm like maybe Ed, I'm a little bit more conservative with my money and probably even more conservative with somebody else's money that, I'm making a decision on. But as long as it's, it is voluntary and as long as the ramifications of joining of enrolling are spelled out to each employee so that they understand it and they understand, as Commissioner Crutchfield stated, that even though there's a very, 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 very small chance that the IRS or whomever could change, could look at this and see that they're not taking in dollars that they used to because of it. And we need to get some of those dollars back, which governments are good at doing that, other than county governments. But I think it's okay. School board's done it.
As long as it's explained, the whole thing and them going in and it's their choice. And it helped them. I want to help them, but I don't want to hurt them.
Put that in motion if we can entertain one.
Yeah, well, I make a motion to that fact.
With that statement in
With that
it,
statement, for
mandatory.
them to be explained totally
Explain to.
and what they're going into, not just what they hear to start with. There's a chance of this or that, whatever, explain to them.
So the motion is just basically authorizing us to participate in the WIMPR program.
Yeah.
With that statement.
Yeah,
about-
with that
Mr. Caveat.
I need to
Mr.
say-
Chairman, I'm sorry, can
Go ahead,
I
Dr.
ask
Spire.
one more question?
Sure, yes,
Okay.
sir, you can.
Are there any penalties associated with withdrawing from the program if someone decides later on they don't want to be a part of it?
Here.
You just asked that just a few minutes ago and you
yeah,
answered it.
there's no penalties, but again, along with it being under section 125, you do have to enroll for the 12-month period. They could
Okay.
get out of the next open enrollment.
Okay.
In other words, once they enroll, they have to stay in that program for a full year, and then after that, they can decide whether to continue to stay enrolled or not.
Because if you mess that up, it jeopardizes the whole 120.
And if I could, that's the way
Go
our
ahead.
health benefit program works now.
Go
If
ahead.
you're in it for a year, you can come out of it under a qualifying event, like you get a divorce, like you have there's 2 or 3 things. that-
Oh, there's a bunch.
Okay. But anyway,
That's why.
Yeah, 13.
I have a motion.
I'm sorry, can
All right,
can I-
got a motion and a
can I-
second. to
can
participate
I
in-
continue that?
Yes, sir. Go ahead, Dr. Spire.
Okay. Mr. Dean mentioned a qualifying event being such as a divorce. What are some of the other qualifying events?
Loss of hours, change from full-time to part-time, additional adding children, moving.
So a county,
Yeah, go ahead, Slava. There's a bunch.
yeah, it's more into a county, going into jail, getting out of jail, death in the family, new birth in the family. There's 13 total. That's all you need to do is type in, show me qualifying life events. These are all well-known, documented. ACA has been around for exactly as long as this plan, so it's easy to find.
These are the same qualifying events that are for ACA, for somebody to get on a plan through healthcare.gov or, outside of an open enrollment.
Yeah, we're all governed by the exact same laws.
You recognize.
There's a good chance, real good chance, within the first year, there ain't gonna be no changes, like, Congress or whatever. It's gonna probably take a year or longer for, if they wanna make changes, for them to make the change. And so for being able to have that 1 year qualification, and then they wanna get out of there, then they probably won't get in any trouble, I wouldn't think, in the first year.
I didn't know this number before, but now that I'm here at our board meeting, we're looking at all the numbers, all the data. Our year-over-year retention is 98.7%. So people they get it, they like it, doesn't cost them anything. And once somebody uses this once they talk to a doctor, see how easy it is, now they just keep using it. You'll see a reduction in your healthcare spending.
Have a motion and a second on the floor to participate in the gentleman's program. All in favor, raise your right hand. All opposed, same sign. Dr. Spires, you with us?
I'm in opposition.
Okay.
I oppose.
Got four yes. Congratulations, your program goes forward.
Thank you, Mr. Thompson.
Yes,
For your time.
yes, ma'am.
Mr. Westbrook, before you get started, I did want to point out there's 2 items in front of each commissioner.
Okay.
One is the annual meeting of the chamber, which is at the RR Ranch on the 12th of March. If you need help, if you want to go, and if you need us to assist with signing up, just let me know. And the other one is when we get to our next meeting, this is the ranking sheet that we discussed. When the commissioners come in, they would fill out the ranking sheet. The number 1 ranking would be your number 1 choice, and number 6 would be your 6th ranked choice. The lowest number would be the highest ranked firm. And so once the commissioners come in and complete this 1, 2, 3, 4, 5, 6, we'll give it to Lindsay and Tyler. They will calculate it, and then the commission would be in a position to potentially make a decision on our negotiating with a law firm to represent the county.
Just to clarify something, not that it matters to me where I sign something or not. Why would you want a commissioner to sign his signature to this?
To make sure that somebody doesn't fill it out for you, or that somebody else is making the decision. We just want to make sure that the commissioner that gives it to us, that's what he wants. That's his decision. That's all I have, Mr. Westbrook. I'm sorry.
Any questions? Y'all got any questions? Dr. Spires, you with us?
I am. I don't have any questions, Mr. Chairman.
Okay. Are we done?
Motion that we rise.
Well, that's my man right there. Commissioner Donahoe moves, we rise. But